Well, thanks very much. It's really a pleasure to be here, to actually be back here. For many of you know, I was here for a number of years a little bit ago. And thank you, Renad, for that nice introduction. I am really thrilled to talk with you, especially because some of my colleagues and mentors are sitting in the back row over there, and folks who actually got me sort of started. This is really your fault, John, but let me talk to you a little bit. What I'm going to do today is talk, and hopefully there'll be lots of time for questions and all. First, I just want to frame this work. This is about mental health reform. This is what our work is about. We're interested in seeing if we can come up with a better way to serve children and families living in inner city communities than the current model. So I'm going to talk to you a little bit about what's wrong with the current model very quickly. I'm going to just talk a little bit about the principles that we use to sort of justify this work, how we think about the work, and these are often called ecological principles, and why we're focusing on schooling very quickly. And then I'm going to talk to you about an experimental intervention that we've been working on for about 5 or 6 years now that really launched our center for, as Renad mentioned, we do have a center that I'll talk about in a minute. And I'm going to show you some preliminary results that are hot off the press that we are just going over right now. And then I'll end off with some future directions for our center, where we're going with the work, and open it up to questions. So before I say any more, I do want to just describe the center very quickly. This is funded by the National Institute of Mental Health. It's called a Developing Center. The full name, Developing Center for Innovation and Services and Intervention Research. Our name for it was Schools as Context for Mental Health. And the concept we wanted to get across is that thinking of schools as a place for us to bring our programs is the wrong idea. It's a misunderstanding about how valuable schools are to children and how valuable they are to their mental health. And we made the case to the NIMH, and we were funded to develop this center to sort of promote this idea, and I'm going to talk to you about that. My outstanding colleagues, you can see this is a virtual center. We have folks from Robert Gibbons from University of Chicago. It's based at University of Illinois Chicago with my colleagues and me. And we have statisticians galore and David Henry, Bridget Homry from the University of Virginia, and Charles Glisson and his innovative work on organizations. We'll just chat a little bit about that. Sonia Schoenwald and her colleagues, Medical University of South Carolina. Elise Capella, whose father is on faculty here at Annenberg, Joe Capella, by the way, and Stacy Frazier, now down in Miami area. And I'm going to talk to you a little bit as we go about some of the work that these guys are doing, especially EndIt, because the innovation of this project is really theirs, I would say. So this concept of drilling deeper was one that Bob Pianta, who's a colleague from University of Virginia, came up with. And I should tell you, I first had an oil drill, and I kept thinking of all that oil going into the Gulf, and I said, no, I don't want that. So I put the ocean in there. But I'm going to chat a little bit about some of the basic concepts of social relations, social network theory, a little bit about organization. But I'm really going to focus today on mental health practice and what we're thinking about with mental health practice, and the way we're thinking about it, and some of the initial results, and then where we plan to go. So talking a little bit about mental health. So to begin with, this is largely an unprecedented time with children's mental health. It's only been in the last 10 years or so that it's really gotten on the national map, starting with the first ever Surgeon General's report on mental health, which included a section on children's mental health, followed by the President's New Freedom Commission. And the conclusions, and these conclusions we've known for a long time. The system is fragmented, disconnected, inadequate. I'm going to show you a little bit of that. This was a study done by Cheryl Kataoka and colleagues at the Rand Institute in Los Angeles. They took 3 large national data sets, somewhere in the neighborhood of 50,000 families, and noted for all kids whose parents reported that there was a mental health need, they wanted to see how many of these kids got services. And what they found is, across the board, meant to do that, this is unmet need. So close to 80%, you see with Hispanic kids, over 80%, uninsured, over 80% unmet need. Now this is data based on largely end of 1990s, but there isn't any more recent data than that, and I'm going to show you some of our own data that indicates that things haven't gotten much better. This is unmet needs. So this is largely 1 in 5 kids who have a need for mental health services get any service at all, and the quality of the service is another question. It's followed up by a large epidemiological study done out of the Great Smoky Mountains, known as the Great Smoky Mountain Study, of course, and Barbara Burns and colleagues whose name I just forgot, but I'll remember in a minute, looked at the, they've been following kids for generations to see what the mental health needs are and all, and one of the studies they reported was where the kids were receiving services, the service sector. So here, the first thing I'm showing you is that down on the bottom is the mental health need as identified by the researchers. So they did diagnostic interviews. So they had 3 groups. They had kids with no mental health need, kids with mild mental health need, and then kids with high mental health need, or SED, severe emotional disturbance. So the kids with no mental health need, only about 10% were getting some mental health services, largely in the health sector. That could be emergency rooms, could be a pediatrician's office. They didn't hit the threshold for mental health need, but somebody thought they had a need and they got it. And you could see with mild mental health need, about 10% of the kids are getting help in child welfare and health, and SED, about 20%. Then we take a look at the mental health sector, and we could see that if you don't have a mental health need by their standards, still about 15% are getting services. Another 15% or so, maybe 18% with mild mental health need in mental health clinics. And look at the kids with high mental health need. Only about 40% of them are getting help in mental health clinics. Where are they getting their help? Well, they're getting their help in schools. Okay, so now here's the data on schools. So of the kids who were getting mental health services, about almost 80% of them were getting mental health services with no identified need. They were getting something in schools. And you can see those numbers were fairly standard, even 70% with high mental health need getting them in schools. So much the way we know that the largest provider of mental health services in our country is the LA County Jail, the largest provider of mental health services for kids are schools, which is not what schools are designed to do, nor is it the place that we would not logically think that they ought to be getting their mental health services. There is another report that came out recently that's I hope everybody who's interested in kids knows about the Institute of Medicine, 2009, which was their revision of a report from the mid-90s on prevention of mental health disorders. And most importantly, what they did was they made the case that we need to stop thinking about prevention as a silo, and we need to really understand that prevention is part of health promotion, is part of treatment, is part of maintenance. It's all important. All of it's important. And we need to start making these connections between health promotion, health prevention, treatment, and maintenance. And one of the ways I often explain this to people when I'm talking to students or teachers or parents and all is I remind people about the situation we were dealing with a few years ago with the outbreak of a virus. You all remember that we were dealing with a virus that broke out, and the world was all mobilized around trying to solve this problem, and a vaccine came out. And what happens in the US when a vaccine comes out for a disease that's particularly infectious is that people with money line up to get this vaccine. So people with money started lining up to get this vaccine, but the World Health Organization and the CDC said not this time. That we're going to deliver this vaccine to the people with the highest need, which were pregnant women and people with infectious disease and elderly. And we're going to isolate folks with this disease. And then the rest of us, we're going to do a public health campaign. And we all learned how to do 2 things. I don't know if you all remember this. But we all learned how to do 2 things. We all learned how to wash our hands, and we all learned how to sneeze into. Do you remember this? It's a big public health campaign to teach us how to do this. And that was an example, it's probably the best example that we've had recently of a successful public health campaign. Now, whether or not washing our hands or sneezing into our elbows really reduced the risk is unknown, actually. But what it did was it got all of us involved, and it got all of us to pay attention. And this is what the report from the IOM, they didn't talk about that, but this is what the report from the IOM was saying, is that we need to understand that health promotion, prevention, treatment, and maintenance is all part of the same continuum. And until we start doing that, we are going to continue to have outbreaks of problems that we don't have control over. And the mental health system is not organized this way, of course. One of the other things that was important, and my colleague Carl Bell in Chicago, who was on the IOM Commission, made me aware of this quote that I think is very relevant to what I'm going to talk to you about. One factor lurks in the background of every discussion of the risks of mental, emotional, and behavioral disorders and antisocial behavior, poverty. Although not the focus of this report, there is evidence that changes in social policy that reduce exposure to these risks are at least as important for preventing mental, emotional, and behavioral disorders in young people as other preventive interventions. We are persuaded that the future mental health of the nation depends crucially on how collectively the costly legacy of poverty is dealt with. Point the IOM was making is that we cannot distinguish between our mental health programs and the social determinants of poverty, that they are all linked, and we need to start addressing them. So what does this have to do with schools? Well, let me pivot now to what's going on in education. So I've got a ton of studies I can point out to you about how important schooling is to children and their mental health. I may even have a slide in here. I can't remember if I included it. But let me just say that the extent to which kids achieve in school, I do have a slide in here, I'll talk to you about it in a minute, has large significance. I think we all understand that. But when we think about schools, before we think about the mental health benefits of schooling, when we think about schools, we need to really understand what's going on in schools right now. Because just as there's a national discussion about mental health, there's a larger national discussion about education that we've all heard about. Now, I'm from Chicago, and you all might have known that there was a strike, and the brother of one of your faculty members is our mayor, and was very antagonistic towards the union, and we had a lot of tension going on and have a lot of tension going on. So what's happening in education, of course, is we have this national dialogue, the No Child Left Behind, or as I was sharing with John, the No Child Left Untested law, which basically says that if we test all the kids, we'll find out who's achieving and who's not, and then we'll get the kids out of the bad schools and put them in the good schools, except it doesn't work that way. It's not quite that easy. But the schools are dealing with that pressure. And without getting into a discussion about whether that's good or bad, which we can have later, let's just note that that's a pressure the schools have been feeling for the last decade. And then school violence, which is not just an urban issue, it's in suburban and rural communities. We have the global marketplace with China and India rising. The US is 25th in math and 21st in science nationally. I call this another Sputnik moment, and I say that realizing that 3/4 of the people in the audience have no idea what Sputnik is, so let me explain. This was an issue, and some of you may know this. Actually, I won't do this to you, but I love actually hearing what people think Sputnik is. It's fascinating to hear people say. But this was a situation where the Soviets were the first ones to launch a missile, went straight up in the air and it came down. And the country went berserk, right? Why? Why do you think the country went nuts? You know. But why do you think the country went nuts when the Soviets did a missile in 1957, went up and came down? Well, they were first, and there was the Cold War, and they were going to bomb us, and then they were going to put somebody on the moon who was going to bomb us, and then they were going to circle the earth and bomb us, and they were better at science than we were. So it started a national dialogue about math and science education, and actually had somewhat of a positive benefit in that regard. And here we are again. Here we are again, where we are being outranked by developing countries and by other European countries. And that is also a national dialogue, although I'm afraid it's a bifurcated national dialogue about whether my kids are doing all right and your kids are doing all right. But my point is, these are the pressures that schools are feeling, okay? And so another way of organizing it. Concerns around teacher quality. This one says you like Mr. Wooford, he has an attention deficit disorder. Concerns about school safety. I'm going out for recess, cover me. These are, national cartoons about that. And then teacher stress. This one I like, came out of New York Times. Low morale, depressed, feeling unfairly blamed for the ills of society. You must be a teacher. 50% of teachers in high poverty schools leave within 3 to 5 years. 20% of all teachers. My colleague Elisa Chernoff wrote a nice paper about teacher stress in school mental health. Urban schools overcrowded, large class size, deteriorating conditions, significant unmet mental health needs. Teacher shortages due to migration and attrition. 20%, I mentioned, leave within 5 years. New teachers often placed in the hardest to staff schools. Behavior management is the most common reason they leave. And where is this in the discussion of effective schools? Or sometimes I go to meetings where the whole discussion is around why people aren't using our mental health programs. Where is the discussion about the context in which this is going on? These are the schools that our kids are attending. What is the mental health significance of that? And that's the question that my colleagues and I were really interested in. So what is the mental health significance of being in this kind of an environment? And why is the mental health community sitting back in their clinics waiting for kids and families not to show? That was the question that we were really interested in. So here's my slide on. The way we describe it is school goals are mental health goals. They're the same thing. So just very quickly, and I could talk about this more a little later, but schooling is predictive of delinquency, academic failure, low school bonding, truancy, all predictive of kids dropping out of school, all predictive of kids getting in trouble. And a study out of Emory University in Atlanta, it's this one, the Ensminger and Sluzerich. Wow. 1992. They studied about 1,000 kids from kindergarten or first grade? First grade to graduating from high school. And they found that low grades in aggression in first grade were highly predictive of not graduating high school with an effect size of 0.78. So generally, an effect size of about 0.6 or so is considered important. 0.78, that's first grade predicting not high school. That's scary. So that's a national tragedy, and that's something we have to do something about. And then academic achievement, protective for urban children. Margaret Spencer here at Penn has done some of the best work on that. So, we've been thinking about this, and we've been thinking about it in terms of ecological principles. Like, what does this mean for mental health? So one of the things my colleague Stacey Fraser and I wrote about this recently. So one of the ways that we define ecological principles is to think about what would happen if mental health services actually supported the settings in which kids lived, the important settings in their lives. So the first thing we thought of is think about the primary mission of the setting and consider whether that's important for kids' development and mental health. So schooling, as I just mentioned, is. But so is after-school programs. If you keep kids in after-school programs, they will get in less trouble because they're supervised, and hopefully they're learning some social relational skills. So you have to have different goals. You don't take the same program and bring it to schools and after school. Now, those of you who are not in the mental health business, any of you not in the mental health business, probably don't know what I'm talking about, but believe it or not, what mental health people do is they develop their own program and then they bring it to different settings to say, here's my program, use my program, it'll fix your problem. Sorry, I meant my problem. Sorry, I meant your problem. Because it's really my program, right? And we have this phenomenon in academia in which we develop programs and we get famous for doing that, and then we go to settings and figure out who's going to take them. And you know what happens when the settings don't want to use them? We call them names. We say they're resistant, right? Bad principal, bad parent, we do a lot of that. So what Stacey and I and my colleagues were saying is, so what if we do that differently? What if we say, what's the mission of that particular setting? And then we say, so how does that mission advance kids' mental health? So the question isn't how can they use my program, but what can we do to advance that mission? And then how do we reallocate mental health resources to support that? So that's how we understand ecological principles. It's not necessarily anything, I think we kind of made it up, but I think it's kind of logical, and it's a premise that we started with. And now our question is, can we do that in struggling urban schools to advance kids' learning, to help schools be better schools? That's really our question. The last point, always think sustainability, no shortcuts. This is not, I used to have I should have a slide on this. I used to have a sign in my office that had, you know, a circle with the word demonstration in it with a big X through it. No more demonstrations. We've demonstrated enough. No more grant-funded projects that later we'll figure out how to get people to use them. We're over that. That's done. Renat and I were chatting about this is an exciting time. There's an interest in implementation science. Implementation science means how do we get people to use our programs, right? Well, we're going to need to change that dialogue too, because it's not about our programs. It's really about advancing the mission of these settings that are important to the lives of kids. Some of you may recognize this guy up here. This is Yuri Bronfenbrenner, who Cornell University was really famous for advancing the notion of an ecological perspective in which we understand. Now, I hope you're seated here because this is pretty radical, that kids live in families, that families live in neighborhoods and and so on. I mean, you know, this is 1965 and people were sort of identifying kids and pulling them out and all that, and Bronfenbrenner said, you know what, they live in a context. Let's understand them in that context, right? And then when I think about ecological, then I have our former president, who was our president for about 3 minutes, if you remember, those of you who remember the 2000 election. And the reason I talk about Al Gore is because, you know, we know Al Gore for how he advances the notion of ecology and how interacting, how we need to be thinking about our climate and our ecology in that regard. Reciprocal relations among natural elements in an environment. And I ask you to just think for a second what that has to do with schools. Reciprocal relations among natural elements in an environment. And the economists talk about, I mean, there may be an economist in here, I may be in trouble, but talk about opportunity costs, right? Which is to say when you're doing one thing, you're not doing another. We've got to think about that in schools. We've got to think about what we're asking teachers to do, what we're asking parents to do, and whether that's a priority. So, you know, I can go on. I think I'm going to move through this quickly, but just thinking about the word sustainability, there's 3 definitions of it. I'll put them all up here. Able to be maintained at a certain rate or level, right? That means the environment can do it on its own, right? Conserving an ecological balance by avoiding depletion of natural resources. Anybody who's spent any time in inner city schools understand that human resources are scarce as well as physical resources are scarce. We need to be very thoughtful about how people are spending their time and then able to be upheld and defended. These are all dictionary definitions of the word sustainability. That comes from law, of course. That means that they can justify what we're doing, that they understand it enough that they can justify what we're doing. This is Ev Rogers, and he is most famous for the concept of diffusion of innovation, which is the notion of how innovative interventions are taken up by people. So how does Apple get people to buy this phone that costs more than everything else and probably isn't even as good? How do they do that, right? Well, you know, Rogers studied this, and I can talk more about this later, but he started studying this in Iowa with farmers, and they were trying to figure out how to get farmers to do innovative irrigation. And Rogers noted, and Rogers and his colleagues noted, that when a particular farmer started it, other farmers followed, and they called them key opinion leaders, right? Innovative interventions initiated by a relatively small segment of opinion leaders via modeling. The innovations are diffused through the population, influencing others. And here is my favorite line out of Ev Rogers' work, which relates to every mental health provider I know. He noted that despite their knowledge, professional change agents often have little or no influence, right? So despite however smart we think we are, if we're not part of that network, that social network, we're probably not going to have a lot of influence. I use as an example a recent Apple ad, a recent Samsung ad I saw, in which they showed people standing in line for their iPhone 5, and people were showing the Samsung and how cool it was. But the coup de grace was a couple of people in line, a couple of young people in line were saving it for someone else. Who were they saving it for? Their parents. The dreaded, I think that killed the iPhone 5 forever. Just the idea that it's so uncool that even your parents would use it. This is a concept of key opinion leaders. Very quickly about social networks. This is Ronald Burt from the University of Chicago. And he really's done, in my estimation, and in the estimation of the person who matters most to me, my former grad student, Jenna Watling-Neal, who's the smartest person I know about this stuff, turned us on to this notion about how Bert understands how information is diffused. 2 steps. First, you have key opinion leaders, people who you respect, who get you to try it. But the second step is that you're not going to use it. You're not going to, you know how many people have ever, this is for the older people in the audience, have ever tried something and then found out you couldn't use it and you put it in a drawer somewhere, right? And so what Bert figured out is there's people in our social network who are like us. And when we see them use it, then we are more likely to pick it up and maintain it and so on. And this 2-step process we've been studying. This is a schematic of a network of teachers, and the ones in red are the key opinion leader teachers. The 2 of them together are connected to everyone. Notice this teacher isolated out here and out here, connected to this one person, this one through a tie. So this is an important concept that we studied. This is a grant that we had through the NIMH paper we published in Journal Consulting and Clinical Psychology, where we studied the degree to which teachers were picking up new interventions as a function of whether or not they interacted with a key opinion leader in their school. And this just indicates that they were significantly more likely to use more interventions 12 months out. The control schools caught up, that kind of thing. So, and not earth-shattering, except the only other study was done in Texas and indicated that key opinion leaders didn't matter with teachers, and we thought it was important to establish that they do, and they do matter. Jenna's pointed out that, this is dangerous for me to try to do this without Jenna here, but for every additional 1 use by teacher A, the target teacher is expected to use the strategy an additional 0.25. But for every target used by teacher C, the target teacher is expected to use the strategy 0.46. Her point is that C is more like the target than is A, and the point there is that C is also influenced by A and B, as is the target. And this is a classic social network perspective that looks at what's influencing people to use interventions. I better move quickly before you ask me a question about that, so I'm just going to move on here. But this is a little bit of the upside and downside of having a center. You get all these really smart people around you, and their work is really cool, but they're not here when I need them. Okay. I have no idea how long I just took, but I now want to talk to you about our intervention model. Now, everything I did just now was a setup for the fact that we felt the need to design an intervention model that we thought had a shot at getting teachers and parents to be using to be advancing their kids' learning. And the idea, the concept here was to get teachers, parents, and mental health providers all united around the concept of learning, which was not hard to do. Mental health providers all understand that learning is important. Parents get it. Teachers, it's their job. So we wanted to see if we could link the mental health community mental health resources with indigenous resources in the school. And this was all sustained through Medicaid fee-for-service funding. So the grant funded the training of the teachers. It funded the training of the mental health providers. All the service delivery was billed through Medicaid. Audited twice, approved twice by Medicaid. So I think it's a sustainable model. So here's the way the model works. So we start with the concept of academic achievement, right? And our hypothesis is that if we advance academic achievement, we'll see improvement in school and home behavior. But the predictors of academic achievement, summarized here in these boxes, by teachers, effective instruction, classroom management, parent outreach, by parents, home-based activities, and linking to the school effectively, good communication with the teacher. And, whoops, uh-oh, now I'm in trouble. Next. I don't know. I'm at Penn. You guys will figure it out. See, I just don't know how to do the, got it. Thanks, sorry, Christine. So the idea was that the teachers were not going to be influenced by the mental health providers. They're going to be influenced by other teachers, key opinion leader teachers, as were the parents. And we used parent advocates who were hired by community agencies. These are parents from the community. And we had them link with the parents in the project. Taught the mental health providers to support these guys in certain activities, which I'll explain in a minute. Okay, so there's a lot of moving parts, but the essential point is that we want to see if we can get teachers doing the kinds of things that we know to be effective. We want to see if we can get parents to do some things supportive at home, and whether all of this will lead to improvements in kids' academic performance and behavior at school. Sample was 7 high poverty, very poor performing Chicago public schools, 4 community mental health agencies, 171 students. See that we had more, we call our project links or links to learning. We had more kids in the experimental intervention than the control, which I'll explain in a minute. Grades K to 4, 136 teachers, 3-year intervention. And this just to give you an idea of the kinds of problems, but I see that, no, it didn't show up. This is supposed to be hyperactivity, inattention. This is conduct disorder, impulse oppositional. So these are disruptive behavior disorders. The thing didn't show up down there, but these are, so that's the baseline. That indicates that the kids were largely experiencing disruptive behavior disorder. So how did we get this information out to teachers and mental health providers? Well, the model we used was that we developed a web-based course at our university, and we invited the key opinion leader teachers who, by the way, I should say, were nominated by their colleagues. We actually did a survey or a sociometric of teachers, which we asked them, we asked all the teachers at each of the schools, who do you go to for advice when you have a concern about a student's behavior? Who do you go to for advice when you have a concern about a curriculum issue, and so on. And then we identified the teachers through that network process that I showed you before, who the two teachers who could impact, who were nominated by the most peers. And then we sent them a letter and met them and said, congratulations, you've just been identified by your colleagues as an important person in your school. And their first thing to us was, please leave. I don't want to talk to you. It's a little bit like, I don't know if any of you are getting emails from either administration, but I'm about had it with that. So I think they felt that with us. But essentially we talked to them about that what we wanted to do was we wanted to help the kids at their school achieve better, and we needed their help to see whether the programs that we were using made sense. So we developed this course, they took this course, and afterwards we paid them as consultants on the grant to hold and by the way, they got master's level credit for this, which fed into their salary. But we paid them to then hold workshops in their classroom, either before school or after school, to invite their colleagues to come hear from them what they found important in this course. And their colleagues got professional development units for it. So the concept was a professional development series at their school, run by the key opinion leaders at the school, nominated by the teachers, and teachers get professional development. So that's how we got the word out. That's how we got the information out. Step number 1 of Bert's model. We used key opinion leaders to disseminate the information. Step number 2 was harder. We needed to get teachers now to start using it so other teachers can watch that. And the only people we had to advance it were the mental health providers. Here was the grand experiment. Mental health providers paired with key opinion leader teachers going into other classrooms on behalf of the students on their caseload to see if the teachers were interested in using and learning some of those programs, some of them universal, some of them targeted. This is described by Jenna Watling-Neal in The Community Psychologist, has a nice description of this if you're interested, and if you want, I'll contact me and I'll be happy to send it to you. And these were the classroom intervention strategies that the key opinion leader teachers selected. The good behavior game, which is a very simple class-wide behavior management strategy. Peer-assisted learning, in which students actually coach each other. John's done amazing studies on this. Good news notes, in which the teachers send notes home, positive notes home to the parents instead of the negative notes home that the parents usually get. And that's universal. That was done with everyone in the class. And then the targeted for the kids who are on the caseload, daily report cards. This is where you identify 3 to 5 issues the teacher and parent agree on, and they get sent home. Individual tutoring, and then good news notes again. And I can talk. There's one of our parent advocates, Bridget. Bridget is now getting her master's in social work. We're very proud of her. She's doing great. And there she is cooking, which of course is what they recommended we did when parents showed up, is feed them. And home routines that support learning, and these are just logical kinds of things you'd expect, doing homework, reading opportunities that were challenging for some of the families and stuff, and then communication. So let me just present some data, and then I'm going to finish up with future direction. So I will say, so we have some findings that I think are promising, but I will say I don't think we're nearly done. I don't know that we maybe have gotten started, I think, and I'll talk to you about that. But this shows the common result that leads people to want to work in schools if you're a mental health provider, which is if you're in the clinic, this stands for treatment as usual. If you're in the clinic, kids and families don't show. Now this is Kataoka's data all over again, about 1 in 5, right? Now I should say we went through great, we put a lot of energy into getting these kids and families into these clinics, meaning we set up appointments for them. The clinics were all within a mile of the school, so there was no traveling that was going to get in the way. And all these parents had indicated that they want to. In fact, I wrote myself a note here. So 73 of the Lynx families enrolled versus 60 in the control, which was a significant difference, but 60% of the control families said, yes, I want a mental health service for my kid. And then 100% of the Lynx families actually got the service, but only 27% of the control kids, both of which are significant. And at 3-year follow-up, these are percentages of kids in the study whose families who remained in the school. If they left the school, we were no longer able to service them. So 36% of Lynx families stayed in the school and stayed in the study versus 17% in the control. So it was a 2 to 1. So you know, again, we can show, but this just sets the context for the fact that we can get at the kids using these school-based models. Now the question is, can we do anything with that? I also want to sort of talk about an urban legend that teachers won't do any of this stuff. Now I will say maybe the key opinion leader stuff really helped. Maybe that's possible. But I also think teachers want to do this stuff. I'm kind of reminded of some of Renad's work. If you don't know Renad's work on mental health providers who actually, when you present stuff to them, are not as negative about it as you might think. It's just how you present it. So what this indicates is this is a bar graph showing that, look at the level of universal strategies. This is per week, and I'm sorry the slides aren't showing up, but this is a number of times they've used this per week, and so that's pretty darn good. I mean, they're using these strategies, per month. They're using these strategies a couple of times a week, which is pretty good. And these are the targeted strategies. You'd expect them to be smaller. They're only for the kids who are on caseloads. But this is pretty good. So that's an urban legend that I like to help dispel, that urban teachers are not interested in using these strategies. Not true. Not true. It's really up to us to figure out how to deliver this in a way that's going to make sense. These are our dependent measures, which I'll go over quickly. I'm going to be presenting the ones that are highlighted. The classroom observations, known as the BOSS, behavioral observations of students' success, Tom? Student success? Something like that. Students in schools, okay. Parent and teacher report on the SSRS, which is the social skills rating system, and we also had the strength and difficulty question. I don't think I have those data. Curriculum-based measures of learning. These are quick probes on how the kids are reading and doing. We did ourselves, so we got an objective indicator of whether the kids were learning or not. We also got teacher report on a rating scale. We have some parent involvement stuff. We have some stuff on teacher stress that we're not ready to present, although some of the parent involvement stuff may be helpful, but I think we have a lot more work to do on that. But let me just go through this. Oh, isn't that cool? It took about 45 minutes to figure out how to do that. I didn't know I pulled it off, but I like that a lot. Yeah, okay. Now this one, I got to say, I kept this in. I asked our statistician to send me a slide on the design, and this is what she sent me. So the only thing I want to say is if there are any questions on this, I'm going to have to ask you to leave. So, you know, this shows random regression models. These are nested models, and what she's modeling here are the three nested things where the kids are nested within classrooms or teachers, and nested over time, and the individual level for the kids are the third level. So as I say, Steve, you're not allowed to ask me anything about that. No, actually, you were certainly entitled, and I'll do my best. But all right, so let me just go over some data. So to begin with, so this slide I failed on. This was supposed to come in one bar at a time, but so essentially, what we found here is a crossover from baseline to spring in that these are classroom observations of kids' engagement, the sort of on-task behavior. So what we see with the control group is they started a little higher. They start a little higher than Lynx, and then we had a crossover where the Lynx kids did a little better in spring, control not. These are peer evaluations. The interesting thing about this observational measure is every fifth interval, you get a random observation of a peer. So what you do is you get to norm these data against what the peers are like in that classroom, which is kind of neat. Now, here's the thing I want to say to you about the control group, which I find particularly interesting, is that because of those data that I showed you about nobody showing up in the control, we knew that after year one. And after year one, we now were recruiting more kids, but we were presented with a dilemma. We could go to schools and say to them, as we did at the beginning, that in this condition, we have a community mental health agency available to see your kids and families. We have referrals. Any parent who wants it, we will get them an appointment in the clinic. But we knew that people weren't showing. And our credibility in those schools, and particularly the staff who were out at those schools, were coming back and saying, I can't show up here anymore because they know that these kids aren't getting services. So we shut down our control group. We stopped recruiting for the control group. We stopped. We had about 60. We continued recruiting in our links. And we also had to stop the observations because the teachers were finding it invasive. So it was a dilemma that we went through. We spent a long time on it, and that's what we decided to do. I can chat with you about some thoughts we have about an alternative way of doing the controls, but that's where we're at. So essentially, the fortunate thing for us is in this BOSS observation, we're able to get these peer comparisons. So these are our Lynx kids here. And what you can see is over time, in the peer comparisons, they're starting to catch up. So that's generally positive. We're encouraged by that. We don't have the control group across 3 years. We saw that the stats folks extended that 3 years out for me, and it looked like we cured poverty in the inner city. So I said, no, we can't do that. We came up with a rule. We had to do this for our statisticians. You're not allowed to impute more missing data than we collected. That was our new rule. Right. I don't know if that's publishable or not, but we came up with that rule. So this is encouraging. We're showing that we're able to. These kids are able to catch up to their peers. It's taking a while, of course, but. And then this is off-task behavior, and so our target kids are, slightly going down, and the control kids are getting worse. Again, we didn't cure anything, but that's encouraging. I should point out that we have some. Oh shucks, I did that again, didn't I? We have effect size estimates, and the effect size estimates for those classroom observations in year one is about 0.54. So that's a moderate effect size, and these are around 0.2 or so. So that's a small effect size. So we're seeing some differences, but not. This is a interesting finding for us. So this we were tracking. These are the curriculum-based measures. This is where we pulled the kids out. Our staff pulled the kids out, and 3 times a year got a probe on whether this is their reading probe. And here we see the control group, and over time people are learning to read, and the very largely no difference on learning until the third year. And then in the third year, it suddenly shot up like that. Now, we don't really understand that. Does it take 3 years to learn to read? What's going on? I will say that is what it looks like in year 3 if we just look at year 3. And that's an effect size of about 0.44. So, that's encouraging. Now, this all needs to be replicated, of course, but it looks like we're getting some effects on learning. These are the teacher ratings, which are showing that over 3 years, the teachers are noting an increasing trend for the LEAKS kids. These are the control kids who are flat. This is a parent rating of social skills. So this indicates that the control group is slightly increasing, and the parents are seeing a higher increase, an effect size of about 0.2. Point is that, so we have some promising trends for parents showing some improved behavior, some promising trends for teachers picking up on academic performance, our own objective measures. Perhaps we're seeing something after the third year. We've got some indicators that the kids' behavior is improved in the classroom relative to a control group. Looks like they're catching up with their peers. The one thing that didn't come out, the teacher rating of behavior didn't come out despite the fact that we have some objective data. And it may be that there's just too much going on for the teachers. It may be that the kids aren't behaving well enough for the teachers to finally notice. We don't know. So as I say, so our take on this at this point, and then I'm going to end by just showing you where we're going with this, is that so we feel like it's promising. We were in very struggling schools. We bring in mental health providers, link them with teachers. We think we're getting some positive indicators that things can be improving. In our center, we have a number of studies going on. Elisa Chernoff is looking at retaining early career teachers through an IES grant. We have a study that we're going to be working on this year that's data's collected of 620 kids in 8 schools, 77 teachers, looking at teacher practices, climate, and student outcomes to see if we can get a composite in each classroom to sort of identify those key factors. This is using Charles Glisson's organizational perspective. My colleague Amy Starron and I are doing a project with community members. There's some private funding on this to support parents and kids in these inner city schools to boost up the parent. And this is using community members from that community. We think it'll make a difference. And then I want to just end off with the last study, which has just been published in Journal of Consulting and Clinical, Elise Capella, mental health consultation to enhance positive classroom environment. There's Elise and there's Bridget Homry, the two Elises at NYU, Bridget's at the University of Virginia, 2 people who designed this study. And what they call it the Bridge Project. Elise took our links to learning model and combined it with a program that Bridget's been working on with Bob Pianta at the University of Virginia. They use a observational measure called the CLASS, which identifies 5 different factors that are important in classrooms to enhance emotional climate. And so what they did was they trained community providers in New York City schools on some of those links activities that I mentioned to you, and then this My Teaching Partner, which uses the CLASS framework on a web-based framework to teach teachers the different components of classroom organization, emotional climate, student relations. Then they randomly assigned them to My Teaching Partner alone versus My Teaching Partner with links, and studied it in 36 classrooms, 364 kids. They showed main effects of intervention on teacher-student relationship closeness, academic self-concept, peer victimization. And one of the really interesting findings was this moderated effect. And essentially the way it went is that in classrooms with low emotional support, they saw a pretty good intervention effect on time to emotional support. That is, the classroom looked, the kids benefited more so in classrooms with low emotional support than high. If they had high emotional support at the beginning, then the time to difference wasn't significant here, but it was here. So the way they described it is that the levels of observed teacher emotional support in the fall moderated the intervention impact on emotional support at the end of the year. And what the conclusion is then is that this may actually be a better way for us to train the mental health providers, because what we're doing is we're teaching them on some of those factors that Pianta, Hamri, and others have shown to be really important in helping kids stay involved and engaged in schooling. So to summarize, our Link Center focuses on a program of research to improve the mental health of children living in high-poverty schools. It's a fee-for-service model implemented by community mental health staff, and we feel like there's some modest improvements in children's learning and behavior, and our ongoing studies will expand the model to activate indigenous resources in schools. And just to end, the way I like to summarize this is given the large need for mental health services in high-poverty communities and the importance of schoolings for children's developments, schools are an ideal setting to promote urban children's health and well-being. But in urban schools, this requires attention to the unique social contingencies that inform and promote school success and the activation of indigenous resources to support these goals. And the goal for us is to relieve schools from the job of providing mental health services by making schooling and successful schooling a primary focus for community mental health. So thank you. I'll stop there.